there's some myths that we always hear about, right? And so there's things that patients will always ask me or say things to me, and I just want you to tell me myth or like fact.
hmm
All right. So anemia is just a female problem.
No, I've seen plenty of male patients come in, unfortunately for anemia, for whether they underwent surgery or they actually have hemorrhoidal bleeding. So that's actually pretty common to really see patients with anemia. But unfortunately, even children get anemic, and
Yeah.
so for different types of reasons. But unfortunately, not. It's just you see it commonly in more in females because they do menstruate.
Yeah.
And so for that reason, the sort of people label it towards that, but unfortunately, it is a non-gender
Right.
causing disease. So
And then another myth is like being vegan is bad because you can become anemic easily.
being vegan can be healthy, okay, but making sure you take the proper supplements. So B12, iron, because a lot of I actually had a Indian patient because he was vegan and he was deficient in B12. And so as long as you're taking the correct supplements, you should be fine. It's just making sure there are certain things that you find in no other products. Folate is in green leafy vegetables, but B12 is actually more meat products. So
Got it.
that's why.
And iron too, more
Iron tea,
products, right?
exactly. But you can take spinach, kale, and like nuts to really supplement the iron content in that.
So spinach, kale, and nuts have a
Yeah.
lot of iron.
Yeah.
Okay. You can't live a normal life with sickle cell anemia.
No, I mean, you can, as long as it's being under control.
Yeah.
Like, you do need to follow up with the hematologist, that's a caveat, and so, the main problem that we do see is patients come into the ER, and so, I think we're sort of jaded in that way, even as a medical student or,
Yeah.
like, and so, we see a lot of those patients that come in, unfortunately, into the ER, and as long as and so the patients, I think we get skewed because those patients that are compliant, taking their medications, we don't see them in the ER.
Right. Right. Exactly. Right. And that's the whole point. That's the whole point of going to see your doctor
Yes.
first. Right. Is like so you don't end up in the ER
Yeah.
urgent care, right?
Yeah, so as long as
Where you're not going to get the appropriate
exactly,
specialist care.
and so, like, and you have to make sure you take the hydroxyurea, taking the X-Jade, iron suppressing medication, like iron, getting rid of medications, and things of that nature.
Hemophilia means you can't get cuts or you'll bleed out and die.
Hemophilia just means that you just have to be careful, and
Right.
so there's medications, and so patients who are hemophilic they actually have a hematologist, and so I don't see a lot of hemophilia now in practice, but I did see them a lot in fellowship because they follow by the same hematologist for quite a while,
Oh yeah.
and so they usually know. They'll be like, "Doc, I need refills on my factor medications and whatnot." So usually they'll understand. So
People with blood disorders, oh gosh. People with blood disorders shouldn't get vaccinated.
you should get vaccinated.
Period.
Yeah.
It's nonsense. If your blood test is normal once,
Oh, no.
fine forever.
No. That's why you get yearly checkups. So unfortunately, it's important to get routine blood work check, and so just to make sure, because anything in life, things can change, and so like even think about your body as a car, and
Yeah.
so you need obvious maintenance, and so unfortunately, when you get older, I tell my older patients, hey, you need a little bit more maintenance.
That's what you tell them. That's funny.
So and they're like, I know. So
Certain blood disorders,
mhm.
does it affect a patient's quality of life?
I It can to a certain degree, just
Yeah.
because they need a blood transfusion, you do need to go to the hospital, you need to go follow up with your doctor and stuff like that and get more frequent blood testing. And so that can affect certain patients. And so I think it's important to take that into factor and be like, and speaking to your oncologist or hematologist, be like, sort of figuring out goals and sort of what you want and sort of figuring out, is this the quality of life and things of that nature. So I think those are very valid questions and very valid points, but also making sure that you work with somebody that puts your priority as needs.